It's a real privilege to be with a group like this. I've traveled quite a bit in my life and worked in different places, and sometimes feel I'm in a perennial state of confusion because I do research in South Asia, I do research in North America, I do research in Europe, I lived in the Caribbean for a while. But it's also very stimulating, I think. So I would think that you get a lot out of just meeting each other and exchanging perspectives, and it can just be so stimulating. So what I'd like to do, I know you come from a range of fields, but you share an interest in public health, right? I'd like to talk to you for about half an hour, and then maybe have some discussion, or while I speak have discussion, that's fine too, anytime you feel like making a comment or asking a question, that'll be just fine. To look at public health through an urban lens. And maybe some of you do that already, and maybe some of you don't. It's important, I think. It's important because, you know, the very common statistic that now more than half of the world's population lives in cities and so on. But it's also important because increasingly what happens in cities determines just about anything. And because the economy in general, national economies, the world economy is taking place in cities. And cities have become incredible growth engines, economic growth engines. And there's a flip side to that, and that is one of inclusiveness or exclusiveness, right? And so it's also very complex. So I hope that for the next half hour that you're not going to think, what is he talking about? And he's jumping around, and maybe there'll be a little bit of that. But it's very complex because these challenges of inclusive development are immediately connected to the incredible economic prowess of cities. So many policymakers don't want to mess with cities, you see, because they are these very powerful growth engines. And that's something that comes back all the time. And we'll see that in some of the examples. And another reason why it's so difficult, a difficult thing to look at, is that cities are very complex systems. So they're economic systems, they're social systems, they're spatial entities, they're infrastructural systems, they're political systems, often fragmented political systems, and it makes it quite difficult. So it's not an easy topic, but I think we'll have a couple of different ways to discuss it and hopefully look at it in some ways that perhaps you haven't before. So I'd like to do a couple of different things. I'd like to discuss with you the significance of what I would call the new urban economy and what that entails, and what that entails also in terms of the challenges of inclusiveness. And it's a new economy that is a highly urban type of economy. So I want to say a few things about that. The title of the lecture is Global Challenges, right? And as I was putting this talk together and trying to keep it manageable, I wanted to talk at least a bit about India, because I've over the last 20 years or so, there are folks from India in the room, yeah? So I've worked in India over the last 20 years or so, on and off, mostly in Mumbai. Are you from Mumbai by any chance? Delhi, yeah?
Very close to Delhi, not exactly Delhi.
Yeah, okay. So spent quite some time in Delhi also. I was there just 2 weeks ago, actually. And of course, I am from Amsterdam myself originally. And so North America and South Asia and West Europe are three very different worlds. And I want to bring it in the discussion. But I also quickly realized when I put the talk together that it would perhaps be too much. And so I'm going to just briefly touch upon the Mumbai experience and the Amsterdam experience, and then focus still on the US. It's okay, I think, because the new urban economy is a global phenomenon. So I think the way we can talk about the US and look at the US urban experience. Actually, it's become a global experience, right? And a good place to start, actually, is to acknowledge, to realize that cities have always been very powerful economic spaces. And it's very hard to think, I would suggest, tell me if you can think of an example. It would be very difficult to think of an example of what we consider a major civilization or a very highly developed society of any sort where there was not also urbanization. You know, so from Babylon, 2,500 BC, yeah, in Iraq, southern Iraq. Anybody from Iraq? Yeah. And not just Babylon, but other cities too, right, in Mesopotamia at that time. Very powerful economic places. To 17th century Amsterdam, a very powerful economic urban space. That's a picture up there. Sorry. I just got this new gadget, so I wanted to try that. That's Chicago, 1915. Again, you know, extremely dynamic economically. And below there is a picture of Shanghai in China. Today, of course, very much the epitome of economic growth and so on, has always been like that. And at the same time, all these places were always challenged in terms of equality or inequality. There's nothing new there, right? But there is something new now, and it has become more extreme in a way, in that the new economy has shifted even more to cities and has caused even more challenges of inequality and inclusive development, as we'll see. And so before we turn to the US, just a few illustrations from both India and the Netherlands, just to avoid that we singularly focus on the US, right? So these are some images from Mumbai, and I started to work there in 1995. 1995 was the first time I ever visited India. And Delhi, actually, the Delhi School of Economics, I gave a talk, and I was so sort of taken by my experience in India and traveling a bit in India that I really wanted to go back. And I remember sitting on the plane going back via Amsterdam to Miami, and I was thinking, I need people to throw money at me to do research in India. And how am I going to do that? And I came home and I picked up a copy of The Economist, and in the back was a table of real estate prices in the world. And Mumbai in 1995-96 had the highest corporate real estate values in the world. And I thought, that's my topic. And people will throw money at me to research this. And so Mumbai was growing very quickly. Lots of foreign investors came in, and it was a very fascinating place because it was so expensive, yet at the same time, it had huge slums and major challenges at the same time, right? So I did a variety of projects in Greater Mumbai especially. On the map to the right, everything in red is slum areas. This is a map of the peninsula of Mumbai, and it has about 12 million people. About half live in slum-like conditions in these red spaces indicated on the map. And if you go to Google Earth, I love to use Google Earth and zoom in and out of cities and just see the fabric, as it were, change. And you see this spatial fabric versus this spatial fabric. It's like two cities in one. Yeah? And so one is the planned city, the city as it's supposed to be, well, as it's intended by planners and government, and the other is the unintended city, and they are typically slum areas that you're looking at. Lots of poverty in these areas, and particularly lots of environmental challenges. Many of the slums in Mumbai are located at low levels of elevation. This is very often true for slum areas around the world. And when the monsoon hits around mid-June, it becomes a major public health crisis every year. And infant mortality rates spike. Most of the sewers are overground, not underground. So when the monsoon comes and there's flooding and the water rises, you can imagine all the problems that brings. And at the same time, Mumbai has become an extremely wealthy city. It is said, for what it's worth, this anecdote, that the Ambani, the CEO of Reliance Industries, has the most expensive home in the world. Estimated over $1 billion, $1 billion US dollars. And it's like a huge building that is all his house, and it overlooks many of these parts of Mumbai. So the challenge is huge there. Lots of economic growth, especially in IT, and India is known for its very advanced industries in IT, and yet this is part of the city as well. This is a graph of Amsterdam. So we go to Amsterdam. Amsterdam, is anybody from Holland here? No? Okay, so I can tell you anything. This is a graph that some people put together, some economic historians put together. The real value of a house in Holland, this is a house in the Canal District, the 17th century district, is higher than it's been for 3 centuries. If you look at what it says for 2010, it says a new record. Right, so corrected for inflation. It's quite something, huh? And I covered up the first part of the graph, so you just look from 1920 on, and you see these increases. Yeah, there's World War II in there that has an effect, but if you look towards 2010, more expensive than it has ever been. And Amsterdam is a flourishing city today, and over the last 15 years or so. Very wealthy, particularly in this new economy, finance and producer services and so on. I'll say a few more things about that new economy in a moment. But there's a flip side to that, and that is that most people that were born in Amsterdam, say 40, 50 years ago, they don't live there anymore. They can't. They're pushed out of the city. So even though this is, your social welfare state and social democracy and egalitarian and progressive and all that, lots of people are pushed out of the city. And I just put together a couple of maps that illustrate how in the city of Amsterdam there is a spatial structure to this inclusiveness challenge. Right? So for the people who still live inside the city, I put up three different maps. One shows you the unemployment rates in the city, and you see more or less where the concentrations are. Yeah? And they are not in the old. So that's the old center, right? That's the Canal District from the 17th century. And you see where the concentration of unemployment is. Then I thought, well, let's look at crime, burglaries in this case. And you see where most of the crime takes place, and it's in the same areas, you see. And then I put in another one that shows you the percentage of Moroccan immigrants, of people of Moroccan descent in the Netherlands, in Amsterdam. And I put that in there because in most cases, and we'll see that it's certainly true also in the United States, inequality and inclusiveness and life chances have a lot to do with your identity. And so one of the big slums that I worked in Mumbai, 95% of the Hindus living there are Dalit, or what we used to call untouchables, right? So the lowest caste, all clustered in that area. In this case, it is immigrants that find themselves in areas, in neighborhoods that are challenging, right? Now you got, and of course what very quickly happens in Amsterdam and many of these other places is that people who are not part of that minority point the finger and say, these people cause problems. They don't work. There's crime in these areas and it's associated with them, and in a way victim becomes pointed at as perpetrator, right? So you get this issue. And there's been a major issue in Dutch politics on how especially Moroccan immigrants are treated and discriminated against and so on. Okay, so it's a global issue, right? These challenges to this new urban economy. And I should say a few more things about it and then use the US from here on as an example. And at least we're all now in the US. You spend time in the US. I know some of you are here for several years, right? So you've come to understand, I think, recognize some of the things in which the US is maybe normal or not so normal in a variety of ways. But let me first say a few things about this new urban economy. So when we say the new economy, we talk about a post-industrial economy, post-manufacturing economy, an economy that is digital, and an economy in which almost everything that is produced has an information basis. You know, there's a good expression by a good term that was introduced by Robert Reich. He's a Harvard economist who was the Secretary of Labor in a previous administration. He uses the term symbolic analysts. So most of us, I suspect in this room, we are symbolic analysts. That is to say, we work with numbers, we work with symbols, words, language, and just about everything we produce, we can digitize. And you can send it to me in an email or file attachment, right? Just about anything. And so what is produced in cities or in this new economy, almost all of it is digital, you see? If you go to, one other quick example to illustrate the significance of this new economy. If you go into the supermarket, I don't know what you eat while you are in this country, but let's say you go to the supermarket and you buy a box of cereals. Yeah? Then you see all these cereals you can choose from. And how much is a box of cereals, let's say? How much does it cost? Huh? Let's say $4. How much do you think is actually the cost of the cereals in that box? What? 15 cents? 50. 50 cents? $1? No. It's a few cents, okay? And it's definitely less than 5 cents, just a cereal. So why are you paying $4 for this? In the first place, you get ripped off, yeah? In a big time, of course. But there is other real cost in that box of cereals. What is the much bigger cost? The marketing effort, right? The advertising effort. The box and what's on it, and the thinking that has gone in what has to go on the box. So it's all these producer services is where the value is. And where does that happen? Not on the farms, not in the agricultural areas. That happens in the cities. Yeah? So that's an illustration of the value of this new economy that's being created in cities. More than ever, the value of the economy today is created in cities. This is why so many policymakers don't want to mess with the cities. Yeah. And why gentrification and all these kinds of things are not even tolerated, they are enabled, because it all happens in the cities. So from 1990 to 2016, 93% of all jobs in the United States were created in major metropolitan areas. Think about that. You know, in this new economy, it's the cities that matter. And what is outside of the cities actually doesn't matter a lot. Not to say it's not still a critical part of it, of course, right? These cereals have to come from somewhere. But in terms of the value, it's become a very different proposition. So New York City today, the New York City metropolitan area, so not just the 5 boroughs, but the larger urban area, represents about 10% of the United States economy. That's amazing, you know. Los Angeles, about 6% of the US economy. If you look at Atlanta, it's a lot smaller, but in the state of Georgia, the city of Atlanta represents about 3/4 of the economy. Yeah? So it's like in Atlanta, we're in an island, on an island in a sea of Georgia, but it's almost all happening here. And so very critical to the economy. So the types of things that happen in this economy is high-tech, producer services. When I say producer services, it means accounting, advertising, marketing, law firms, those kinds of things. And of course, consumption, right? Cities have become major sites of consumption as well. So the flip side of this, of all this growth and all this potential for growth, is a couple of things here. And they're, in a way, geographic challenges, all right? So one observation is that these cities become more connected to other major cities than to what used to be their hinterland. Yeah, so the global connectivity has become very important. So Atlanta is connected to New York, Atlanta is connected to Chicago, Atlanta is connected to Miami, it's connected to Memphis, but what is around Atlanta in Georgia has become much less significant. So there is a growing disparity between these cities and what is outside of urban areas. And there has been a growing disparity within these cities. And I put these two maps up of the state of Georgia for illustration purposes. So the population growth is happening inside these major metropolitan areas. The darker the color there, the higher the growth. The lowest 4 categories of urban growth is actually population loss. So we live in a world now where major urban areas grow, and sometimes grow very fast, such as in Atlanta, and large swaths of Georgia are losing population, shrinking. These places are shrinking. And that's not just in the United States, that's in countries like Japan, South Korea, Germany, the Netherlands, France. It's also happening, right? Because the economy is not there in these other places. Does that mean that from a public health perspective we should just look at cities? No, of course not, because if you look at this indicator, people living in poverty, of course it's in these regions where there's not urban growth that people have lost their livelihoods, lost their jobs. Go to West Virginia, there's talk about the opioid crisis in the United States, shapes up to a large degree in these non-urban growth areas. So of course that needs attention, but increasingly the people move into these major metropolitan areas, and within, and you can even see it, the red circle is Atlanta, even within these larger urban areas, there are big differences in terms of growth and shrinkage and poverty and wealth, right? So if you take one very common measure of inequality across the United States, and that is you take the share of the household incomes in the United States of the richest 5%, and you take that and you compare that to the share of the income of the lowest 20%, you take that as a ratio, you have a measure of inequality. In the US, that ratio is about 9. Right? So in other words, the richest 5% their share of the total income is 9 times that of the poorest 20%. So, I mean, that's a serious degree of inequality. But if you look at cities, the inequalities are much more salient. And it's interesting to see that, you know, we often talk about San Francisco and New York as being these most unequal places, and Atlanta is more so, even. Twice as unequal, basically, as the United States in general. Why do you think that is? Atlanta. Why do you think Atlanta is so, from what you know, which might not be that much yet, but why do you think that is?
Is it just the greater Atlanta area is a federally designated refugee center? Is it because the greater Atlanta area is a federally designated refugee resettlement place?
No, I don't think it. So, is it because Atlanta is a federally designated refugee site? No, because those numbers are still quite small. It's not an easy question, you know. And if I would ask, say, Paul Benson, now why is Atlanta so much? What would you say, Paul?
The property, or say the question again.
Well, so why is Atlanta more unequal? So extremely unequal, even compared to San Francisco.
It's because we desegregated in just 1970, right?
Yeah.
Segregation had a huge impact on Atlanta.
Maybe more so than other cities. Because of course, desegregation and segregation and the civil rights movement was a national phenomenon. Right? And it's funny because when you read about this in the newspapers, they say, yeah, Atlanta is more unequal than other cities. Here's why. And then they say, it's because there are so many poor people in Atlanta. Okay, that's not really satisfactory. You know, I could have figured that out on the basis of the statistics. And yeah, it is true that, say, San Francisco, the inequality in San Francisco is where you have a lot of people who are really wealthy. I mean, really, very, very wealthy. Much more wealthy than the wealthy people in Atlanta. But in Atlanta, there are more very poor people than there are in San Francisco. And maybe it has something to do with minimum wages in California that are higher than in the state of Georgia. But so last night when I was putting this together, I thought, I need to have a more satisfactory answer to this question, why this inequality in Atlanta? And one thing that came to mind is that we are, in a way, regionally, in the south of the United States. And so in some ways, maybe Atlanta you should compare to places in Alabama or Mississippi, in some ways. But in some other ways, this is the most urbanized, new urban economy space in all of the South of the United States. And it's that juxtaposition, I think, that makes it so harsh sometimes. I had a good friend from Mumbai visit in December, and it was his first time in the United States. You know? And it was snowing, and I remember that because I said to him, after 2 days, I said, so what strikes you the most about America? And, well, this was Atlanta, right, that he was. What strikes you the most? And he said, the snow. He's from Mumbai. I said, no, forget the snow. What else? And he said, the homeless people. You know, and it was a very interesting moment for me, because so often when people think about India in the West or in the United States, they think, oh yeah, it's poor and people are on the streets, and here comes a person from India who also happens to be very well educated and a successful entrepreneur in a lot of ways, and he comes to the United States. Yeah, what strikes me the most is the homeless people. Yeah, I want to get back to that issue in a few moments. So I want to show you a couple of maps of Atlanta to illustrate the spatiality of these inclusiveness challenges. All right? And so this is a map that it's, when we talk about Atlanta, there's the city of Atlanta, but mostly when we talk about Atlanta, we talk about the metropolitan area, which is a lot bigger. And everybody uses a different definition almost. Some say, yeah, it's the 5 counties, it's what's within the perimeter road that you see on there, right? In red, you see the perimeter road. That's it. Or it's even 10 counties, or it's 19 counties. It's sort of an ink blot, you know, Atlanta is. So it's not so easy to draw a line around it. But so I use pretty much the perimeter, the highway, ring road that goes around it. And this is a map showing household incomes, and you see the concentration of higher incomes in the north, right? It's a pretty clear pattern that you're looking at. So you can overlay that with a map of food deserts. Food deserts are, I think, a pretty American type of phenomenon. You know, there are no food deserts, at least not in Dutch cities. I don't think there are food deserts in Indian cities. But there are food deserts in American cities, which is a sort of a issue maybe to address also. But you see, if you compare this map to the map of the food desert, so everything in what is that, purple or blue, is a food desert, that it's inversely correlated, right? Which is not surprising, perhaps. But so where the higher incomes are, there are no food deserts, and where the lower incomes are, there are food deserts. And food deserts here are defined as low-income communities, at least at 1 mile distance from where they sell fresh produce. So not a McDonald's or something, but fresh, what is considered to be healthy food, right? And this is another map. It's at a slightly different scale, but it gives you life expectancy in selected zip codes in Greater Atlanta. And it ranges, as you can see, from 84 in the north to 71 just southwest of the topographical center of the city. You see that? 84 to 71. And I quickly refreshed my memory. I looked up in the latest country indicators. So that northern part of Atlanta, 84, if it were a country, it would rank first in the world in terms of highest life expectancy, above Switzerland. Switzerland is 83 point something. Anybody from Switzerland there? No. 71, if you live in zip code where the life expectancy is 71, that's less than the life expectancy in Bangladesh, and it would rank 104th in the world, right? So the interesting thing there is that you have within this urban space a juxtaposition of worlds that are entirely different and that seem disconnected. They're like parallel universes, entirely different. And imagine what that does, and this is just on these variables, but you can use all kinds of other variables, also like we did in the case of Amsterdam. What that does to people's mental maps of cities, where they go, where they don't go, how they value, how they do not value these areas, and the people that live in it, right? And this is the last map to compare for Atlanta, and it's a map that shows race and ethnicity. And everything colored in green, you may not, yeah, you can just about read that in the legend, I suppose. In green is African American, in blue is white, red is Asian, and orange is Hispanic. And these are great maps, not for the implications, obviously, but they are. I'm trained as a geographer, so I do think they're great maps in a way. They're very impressive, also because of the scale, but they are impressive because in a way they seem to underscore that we are an extremely primitive species that either seek to be with like people or are forced to be with like people, right? When you see these kinds of maps, and they are, in this case for Atlanta, but it's the same for other cities in the United States, you have to come away thinking, we are so, we may be urban planners and have social policies and everything, but something is not right here, unless we are okay with it. And of course, there are choices there to be made. So let me make a couple of general observations, and also for discussion, that we can get into, to pull some of these things together. And one has to do with syndemics. Now, how many of you are familiar with that term of syndemics? If you've ever heard of it, raise your hand. So syndemics, when I was at the University of Amsterdam, I was setting up this Urban Studies Institute, and there was a global health institute at the same time being set up. And that's where I picked up this term. So in global health and in epidemiology and in public health. So a syndemic, the word syndemic, it's a very important term, I think. And you have to think of it as a coming together of multiple epidemics, a clustering, syndemics. That's what you have to think of. And so I pulled this graphic from an article by Singer and some other people, a recent article, but he came up with this term, Merrill Singer, I think is his name. He came up with this term maybe about 10 years ago or so. And they look at it from a public health or health perspective as, say, in one person, the possibility of different diseases reinforcing each other. It's almost a little bit like, God, what is that again? Well, I can't think of that term, but let's say the chance of heart disease and the chance of diabetes being connected to each other and reinforcing each other, right? And then also, so I'm talking, this is very much from a public health point of view. I'm not a public health specialist, I'm an urban scholar, right? But these things come together here in a way that I find quite interesting. So the medical folks, they look at this and they say, so you get different diseases coming together in the same person or in the same population, and there is a social component to this because it tends to pertain yes, to individuals, but to populations, right? So there's an environmental factor at work. Now, the maps that I've shown you of Atlanta and the maps that I've shown you of Amsterdam, in a way, show the spatial urban dimension of syndemics. That is to say, forget for a moment the medical stuff. If you look at the city, and you think of the city in terms of its health or lack of health, there are some parts of the city that show a greater propensity for crime, that show a greater propensity for high school dropouts, that show a greater propensity for unemployment, a greater propensity for burglary, and so on, right? So it's a spatial urban syndemics in a way. But then when you look at those populations, those are exactly often the kinds of populations that these public health people are looking at, right? So I really think there is an argument to be made for public health students, if you will, scholars, practitioners, professionals, to take that urban context very serious, because it helps you understand this syndemics that is shaping up. And when I just got here to Georgia State University and I heard about the public health school, I thought, we have to do a project on this, you know, where the collusion, if you will, that word is used way too often lately, or the coming together of diseases at the individual level is related to the coming together, the clustering of social ills in urban areas. So that's one one argument to make. And then there's another, and it's a bit complex. I'll try to keep this short. So if you take that seriously, that argument that I just made, then community comes into focus, right? Because these are particular parts of a city where particular communities live that tend to be afflicted much more so than other communities with deprivation, challenges, inclusion, and so on. So community matters. And I just put up a couple of different, because there's so much to talk about there, but 3 references that I think that have been really important for me in thinking about this stuff. And one is William Julius Wilson, a sociologist. Anybody familiar with him? No? So, yeah, have you read some of his stuff?
Yeah, about poverty.
Second?
Poverty.
Yeah, about poverty. So he's an urban sociologist, but he makes in his book from '96, When Work Disappears, he writes about how communities dissolve when work disappears, and that unemployment is not a one-dimensional singular problem. There's all these other things. A life changes when work disappears, and a community fractures when work disappears. So and then all this endemic stuff comes into focus as well, right? So a focus on community in terms of public health. Now, a very interesting article called The Psychology of Subjective Well-Being by Biswas Diener and some other people. Interesting because they do a comparative study of homeless people in India and the United States. And I remember coming across that, and you know, when sometimes you come across an article, you think, this is what I need, this is what I want, and you go through it in like 3 minutes. And other times you have to read something and you just can't get through the darn thing. But this, I was, you know, absorbing it in no time. And so compare pavement dwellers in Calcutta, in India, with pavement dwellers in Los Angeles, and measure their subjective well-being. And the material circumstances are very different because pavement dwellers in LA and other US cities, and also, for example, in Atlanta, have access to shelters. Have access, so typically the way it works in the US, if you're not familiar with this, you check into the shelter in the evening, you can get a meal, you can take a shower, you can go to bed, blanket, and in the morning you can get a meal, and then you have to go. They close it, and they clean it up, and they get ready for the next cycle. If you're a pavement dweller in Calcutta, there's no such possibilities, and you're on your own. And yet, when they try to measure the subjective well-being, the scores among pavement dwellers in Calcutta was much higher than in Los Angeles. Why? You know, there's often not a single explanation for things, but it's not the explanation they give. The explanation they give is, even if you are homeless in India, you're not alone. It's about community. And in the United States, being a pavement dweller, maybe the most important thing about that condition is that you are alone. And you know, I'm not religious by any standard really, but I was in a orphanage one time, a Mother Teresa orphanage. And there are all these plaques on the wall with texts from Mother Teresa, all the wise things she said. But there was one that really stuck with me that I read, and it said, "Loneliness is the worst kind of poverty." And the idea is that if you find a pavement dweller in India, it's not they don't have family. They do. They're not with their family at that moment because they are looking for work, doing work temporarily, and then they will go back to their family. They actually want to be with their family. They love their family and their community love them. It's for the material reasons that they're out on the streets. In the US, when you are a pavement dweller, it tends to be a saga of having given up on your community, on love, on these conditions. But so the sense of community there is very important. The third reference is from a Chinese-American geographer. And he says, I'll keep that very short. Basically, he says, for people to be fulfilled, to have a state of well-being, you need at least one of two things. You need a society that is organized deliberately to take care of you, that you can fall back upon. A society, it's anonymous, it's impersonal, but it does work. Yeah, there are hospitals, there is a organized support, or you need a community. And these two things don't always apply everywhere. In Indian cities, I would say, in Indian society, community is extremely important, your community that you are a part of. And there is no shelter, in that example that I gave. Society doesn't do much for you, but community does. If you go to a place like Sweden, maybe community is not so strong, but society is very strong. When you go to the United States, how is it?
I said both are not strong.
Right? It's getting painful. But, yeah?
I said that the reason is in the US people are so individualistic, people so focus on themselves.
Yeah.
I'm not sure, I don't know if I'm wrong, but that's the question I have.
Yeah. I think it's a hard observation to avoid what you're saying. You know, maybe it's a bit of an indictment. But if there's no powerful, no strong community, and there is not a strong society to back you up, it can still be a good place, you know, if you can make it. Yeah? And if you can have the independence and affluence and it's all good for you, point here rather is, what if you're not? Then what is there to fall back upon?
I'm not sure about the society part of this country. So like in the last 5 weeks I made experience hitchhiking across this country. I was staying with many homeless people as well.
Yeah.
And what I saw was, I agreed to the family part of it, to the community part maybe, but society-wise, at least what I saw here on the East Coast, is that they got, these homeless people, many crack junkies and other or alcoholics, they get supported with every need they have. And they told, many of them told me, if you have hunger in this, if you suffer of hunger in this country, you are stupid, because you get every supply you need and to be together here. It's your life. So I'm not sure about this society part, like, from my experience at least.
Yeah. There is still, what you're saying is there is still a pretty strong society in place for people to fall back upon.
You get a shelter, you get
Yeah.
clothes, you get food, you get support in many ways.
Yeah.
It's what I saw.
And this very quickly can become a political debate, huh? Because of course in the US it's a very common debate also between left and right. And the quick observation, of course, that would follow this is then, if that is so, then why do you see all these homeless people in Atlanta that you don't see in Stockholm, for example? And so what are they? You have more stupid people in the United States than in Sweden. You know what I mean? So to paraphrase what the other person said. So yeah, I mean, we shouldn't maybe be too dismissive of what exists in the United States, but let's for a moment just say it's a way of thinking about it, you know? That either you organize through community or you organize through society. That's sort of the idea here. And it doesn't have to be one or the other. And maybe it should be both. So I did want to put this up, and the first time I saw this, I thought, wow, that's a pretty interesting road sign. And when I first saw this sign is when you enter downtown Atlanta, coming from Midtown where I live, and I thought, oh, this needs decoding. You know, it's very interesting in how societies talk about their problems sometimes. And so monetary solicitation prohibited zones. So, whoa. What does that mean? What does that mean in 2 words? Yeah, no begging. No begging. No, it's a monetary solicitation prohibited zone. It's, in a way, it almost suggests a negation of what happens there. And I thought, when I looked up particularly what the penalties for it were, I mean, I think the irony shouldn't be lost on us, that if you have a person here who is completely outcast from our community and ends up on the street begging, that if you arrest him and the punishment is that he has to do community service, you know. I hope that irony is not lost on you. I mean, so the sense here of what that community does and how we define community at that urban level is problematic. So I want to end on a very hopeful note, I think, the notion of the urban commons. And yesterday there was a good question, I don't remember who asked it, of that wonderful speaker about the role of states in public health. Who asked that question yesterday? Somebody. Yeah, you asked that question, right? So the role of states, and so that's a political question. And what I would suggest that, yes, states are important, but governance, and so how you govern public health has to become more, not exclusively, has to become more at the urban level. because it has to be managed at the urban level, the same level where these new economies are managed, right? And there's a very promising debate going on about the urban commons that I think you have to be aware of. You know, anybody familiar with Elinor Ostrom, the economist? The first woman economist to get the Nobel Prize in economics, Elinor Ostrom, about the commons. And basically her argument is, have you heard of the tragedy of the commons, this expression? So there's been a tendency among economists to say, well, either the state has to own things and regulate it and take care of it, or the market. One of the two. And in this country, we've mostly gone to the market, privatize, right? And what Ostrom, as an economist, says, no, there's a way in between. Community has to step in. And so there are commons, that is to say common goods, the air you breathe, the water you drink, right, the public spaces in the city that you use, they are common. And you can't put a market value on it, but they're really important to us. And those ideas of hers are now increasingly applied at the urban level, and so people refer to it as the urban commons. And it's to a very large degree about infrastructure in cities, mobility and access. So you have to build a city that is inclusive, and you have to do that by providing an infrastructure that allows people mobility and access to education, access to medical care, access to housing, access to jobs, mobility, right? Is a critically important part of that. Now, at the end of the day, I think all of this goes to politics. Yeah. You have to make decisions. What kind of city do you want? What kind of city do you want to live in? And the ancient Greeks were the first ones to ask that question. You know, in ancient Athens, what is a good city? And it was a philosophical question, and it was a moral question, and it was a question of efficiency. And it wasn't all great, you know, but they had some good things. A lot of public space, relatively little private space, relatively small communities, and so on. These debates, I think, are today very much played out in the US between the federal and the urban level. And the last thing I want to do, maybe you've heard this before, but it's okay to hear it again. The legend of the two wolves, the two fighting wolves. A Cherokee legend, Native American legend, of a village elder who sits with a little boy, and she's telling him about the world outside of the village. And she says, you know, in the world out there, you have to know there's a nasty fight going on, a very tough fight going on between two wolves. And they're very different. And one of them is selfish and greedy and intolerant and narrow-minded. And the other one is compassionate and tolerant and curious, open-minded. And the kid says, so who's winning? And the elder says, the one you feed. And it's that political culture that is going to be at the basis of all of this, I think. You know? And if you're not willing to engage in that debate and to think of it in those terms, then all the policies, all the ideas won't go anywhere. But I think there's really good hope, and this is a very interesting and worthwhile discussion to follow, I think. Thank you.